In general, males nauuna magkaroon ng sakit sa puso by 10 years.
Hello everyone, it's me, Samantha Purvor, welcoming you to another episode of Let's Talk Wellness with Watsons. It's February and buwan na naman ng mga puso. It's the perfect time to check out our heart health as well as the people we love. Pero bakit nga ba importante ang puso? For starters, the heart is responsible for pumping blood throughout the body, distributing oxygen and nutrients to our cells and organs, a process that goes on 24/7. Our hearts beat and work hard for all of us. Kaya naman dapat inaalagaan natin ito. That's why for today's episode, we will be learning how we can keep our hearts healthy at different stages of our lives. But before we dive into it, don't forget to follow us on Facebook, Instagram, and TikTok, and subscribe to our YouTube channel for more health tips. Joining us today is a doctor, healthcare advocate, and one of the country's experts on cardiology and heart disease prevention. Please welcome back the one and only Dr. Tony Leachon. So nice seeing you again, Doc.
Hello, Sam. Hello, everyone.
Doc, to start off, how do our modern lifestyles affect our heart health?
Well, chronic stress and lack of physical activity can actually be linked to a lot of cardiovascular disorders. It can also lead to diabetes, high cholesterol, and hypertension. And it can cause also inflammation or yung pamamaga ng ating arteries.
What are the habits in particular that contribute to heart diseases?
These are the common problems which can cause severe cardiovascular disorders. Smoking for one, and vaping. So vaping has many toxic chemicals like formaldehyde, acrolein, chlorine, benzene that can actually cause inflammation as well as damage, leading to death and scarring of your lung tissue or your heart tissues. And one more thing, Sam, alcohol. It can cause arrhythmia or irregular heartbeat. It will increase your heart rate, leading to loss of consciousness and even cardiovascular death.
But how about our food choices and our food habits?
Ang pinaka-simple is actually follow your healthy food plate, no? So we must concentrate more on vegetables and then fruits and cut down on too much carbohydrates and sugary drinks or beverages. And then, of course, you have to cut down on processed foods because all of these things can actually lead to hypertension, coronary artery disease, cancer, and of course, diabetes, leading to, of course, dialysis.
I do know a lot of people who have diabetes and somehow develop some heart disease. How are these two interrelated?
Well, diabetes is actually a problematic condition. Do you know that in 2021, there were only about 5 million adults with diabetes?
Wow.
And then suddenly, right now, it's about 8% of the adult population. Now, there are two types of diabetes. You have type 1 and type 2. So type 1 is insulin requiring, which is about 10% of the population. Most of the diabetics right now are actually acquired, and we call it type 2 diabetes. Type 2 diabetes are present in obese individuals and those who are actually overweight. They can develop high blood sugar, that's one. Number 2, high cholesterol, and then high blood pressure, leading to heart attack and, of course, stroke. So this is actually the connection between diabetes and cardiovascular disorders.
How does high blood sugar lead to nerve damage? And how exactly does it affect our hearts in the long run?
Alam mo, Sam, its effect actually on the heart is causing nerve damage, and we call it neuropathy. Now, what will happen? That can cause also problems in your circulation. And decreased circulation can cause diabetic ulcers, leading to amputation. So this is really very bad. In addition, unexplained increase in the blood sugar can lead to nerve damage, afflicting the heart, leading to silent heart disease.
at what age should we really start taking care of our hearts?
Well, it's never too early to take care of your heart. Let's talk about taking good care of your heart, not only for older individuals, but also in the formative years. But based on studies right now, heart diseases are actually common in younger individuals and in poorer individuals because of their access to unhealthy diet and, of course, unhealthy behavior.
But how can parents actually support their teenagers or even their younger kids when it comes to addressing their heart health?
It has to have a halo effect on their children. And the only way that you can actually do that is to role model it so that your kids can actually care about their health. So basically, it's about preventing all these vices like alcohol, vaping, managing an ideal body weight and exercise, and reducing a lot of stresses. And of course, try to reduce all these gadgets.
But specifically for women, how exactly can they take care, or can I take care of my heart, specifically if I get pregnant?
Well, very nice question, because pregnant women are vulnerable to a lot of diseases. In the first trimester, if women are not careful, they can cause some problems like viral illnesses or congenital heart disease. Kung after the 20th week of pregnancy, if you gain weight, then you are actually predisposed to development of diabetes and hypertension. And this can be dangerous during the time of the delivery of their babies.
How about the special population, especially women who go through menopause?
Dalawang klase kasi ang menopause eh. The first one is after the natural menopause, and usually that's after 50 or even mid-40s. And the other one is surgical menopause. Yung inoperahan sila dahil meron silang, let's say, myoma or cancer, no? But in general, males, nauuna magkaroon ng sakit sa puso by 10 years. But when you develop menopause, you actually will have the same risk factors. Tataas na ngayon ang level ng cholesterol mo, tataas ang blood pressure, blood sugar mo. It's because of the protective mechanism of estrogen. That's why women, late sila nagkakaroon ng heart disease by 10 years.
Doc, how do you see senior adults and how they should be taking care of their hearts?
Well, that's another good question. Kasi you just hit a nerve here. Ang definition kasi ng seniors in the Philippines is above 16. And the lifespan of Filipinos actually 72. Pero you want to live up to 80, no? Why is it important to take care of yourself when you reach 60? Because this is the time you develop these important diseases. Number 1, heart disease. We call it coronary artery disease or ischemic heart disease. Number 2, cancers. Number 3 is hypertension sa pagkain ng maalat, no? At kumikipot yung ugat. At ang pang-4 is diabetes. Being senior is not just a walk in the park. It is the time that you should be careful about your health because this is the most vulnerable period in your lifetime. So when you reach senior citizenship, ika nga. So please take care of your heart because this is the time that your horizon is actually limited.
Doc, I noticed that when it comes to heart health, exercise is always crucial. But how exactly do you tell someone to start?
Ako naman kasi I've been an athlete all my life. But when you reach a certain age, kailangan mo i-redefine yung exercise.
Yes.
Exercise can actually increase your blood flow to the heart. According to the Harvard Health, it should be 30 minutes a day. Now, ang 30 minutes is about 3,000 steps yan. Equivalent to around mga 150 calories.
So, Doc, can you tell us how much exercise we actually need to keep our hearts healthy? And I do know for a fact that this changes as we age.
If you start to say 5 minutes every day, right? And then the next week, 10 minutes.
Yes.
And then 15 minutes. Pero dapat ang minimum exercise should be about 30 minutes a day. Hindi kailangan rigid. Hindi mo kailangan tumakbo. Pattern your exercise according to your work.
Now that we're talking about exercise, Doc, is it true that too much of it can be bad too?
Yes, of course. Kailangan hindi natin persahin ng exercise. Ang kailangan natin ay gradual exercise eh. Kasi what will happen, let's say, nag-over-exercise ka at hindi mo kaya, then you will develop pains and of course injuries. And there are some medications like statins when you over-exercise can cause muscle damage. Kaya hinay-hinay lang.
Doc, in the last few years, we've discovered new ways of using technology to better take care of our hearts. But what's your point of view when it comes to that?
During the time of the pandemic, nauso yung telemedicine eh. So with technology right now, we have smartwatches, you have AI, but in medicine kasi, we should not forget the doctor-patient relationship. And these are actually basic sa akin. So taking your blood pressure, using of course your gadgets, okay naman yan.
Yeah.
Wala namang issue about it. Ang importante lang, mini-measure natin. Measuring the blood pressure is important because there are patients na nag-i-stroke, hindi nila alam mataas ang blood pressure.
Doc, what's your take on automatic blood pressure monitors?
You know, Sam, nagbago kasi ang pag-monitor ng blood pressure. The World Health Organization, tinanggal na kasi siya yung sphygmomanometer using mercury.
Yes.
And that's why, ang nire-recommend is the mga digital na nabibili natin sa mga, outlets, drug outlets, mga pharmacy. So, walang masama dito. The only problem with that is that if we don't calibrate that at the doctor's clinic, kasi sometimes, baka mali yun eh. Okay? And then, check also the batteries, baka may lobat. And therefore, hindi yun ang tamang blood pressure natin. And you buy the right quality monitoring apparatus for your blood pressure.
And lastly, Doc, are there any supplements out there that can help support our heart health?
Nagre-research ako dyan eh. Nagte-take din naman ako ng supplements. And yung mga proven, vitamin D, that's very good for your bones and your muscle, no? Vitamin E, which is antioxidant, anti-aging, no? And I take one multivitamins lang, no? But yun lang. Sa akin kasi I'll take supplements kung talagang kailangan, but don't overdo that kasi it may actually damage your liver and your kidneys. And then, kung kailangan natin ng supplements for the heart, meron din mga carnitine na nakakatulong. So, kung may pasyente tayo na talagang may severe heart disease, wala namang masama using these particular supplements as long as meron tayong advice ng ating mga personal physicians. Napaka-importante yun.
You heard it from Doc Tony, guys. Always consult your doctor before taking supplements. Now, Doc, can you share a few takeaways with us before we conclude this discussion for today?
Alam mo, nag-reflect ako niyan eh. When you're actually in your sunset years, I think ang pinaka-importante ay yung health is wealth. I have 4 Fs. Number 1 ko is faith. Faith in God. And sometimes nakakalimutan natin yan eh. The second F is about family. So if you take care of yourself, then you take care also of your family. Right? And be role models also to your kids and your apo. Number 3, I have a few number of friends so that you can actually exchange yung mga deep conversations on life eh. And relationship matter eh. Isa yan sa pinaka-importante. The last F is about fitness. And I'd like to repeat.
Yeah.
Physical fitness, number 1. And then mental fitness, right? And then emotional fitness, right? And the last one is spiritual fitness. And knowing that heart disease is the number 1 killer disease in the country, we should take care of our hearts. At ang pinaka-importante nyon, adhere to healthy habits. Habits determine your behavior, and your behavior will determine your destiny in life.
Such a wonderful discussion, Doc, especially that we're approaching it holistically as well. And I can't thank you enough for joining us here for today.
Thank you very much, Sam, for inviting me. It was a great pleasure. Stay healthy and stay well.
It's never too early to start taking care of your heart. Kaya naman ngayon pa lang, we should start thinking about adjusting our lifestyles para mas maalagaan natin ang mga puso natin. And to help us remember our discussion with Doc Tony Leachon earlier, we invited our Watson's pharmacist, Diane Renlin Lopez. Welcome to the show, Diane.
Hello, Sam. Hello, everyone.
Before we get started on our game, Diane, can you tell me what you learned from the discussion with Doc Tony?
The most important thing that I have learned from Doc Tony's discussion is knowing the factors that are related to heart diseases. There are several factors that he mentioned: vaping, chronic stress, and even diabetes. As a Watson's pharmacist, it is not just about dispensing medication, but also providing them and reminding them essential information for their overall heart health.
I absolutely agree with you, Diane. And since buwan nga naman ng mga puso, we're going to be playing a game called Love or Let Go. We're going to flash habits that may or may not be good for your heart. And you, Diane, will be telling us if we should let them go or if we should love them. Are you ready?
Yes, game.
Okay, so the first one is eating red meat 3 times a day.
Let go. Red meat is high in saturated fats and cholesterol that may lead to heart-related problems.
Walking 30 minutes daily.
That's love. Walking is essential for our heart health fitness. It can also lower cholesterol levels and reduces the risk of strokes and other heart-related problems.
How about relying only on health tracking devices for everyday heart care?
Let go. Health tracking devices like BP monitors and smartwatches can help us, but we cannot rely on them alone. We need to visit our doctors regularly for better heart health management.
Consulting a cardiologist regularly if you have diabetes.
Love. As mentioned earlier, the best thing to do when you're diagnosed with diabetes and any other heart-related problem is to consult your doctor for proper treatment.
Wow, I'm really impressed, Diane. You got them all. And thank you so much for joining us here today.
Thank you, Sam, for inviting me.
Taking good care of your heart requires discipline and consistency so you can keep it beating healthy for longer. And when it comes to your daily heart care tips, supplements, medicines, and equipment, you can always count on the Watson's app and our 1,100 plus stores nationwide to bring you your essentials with love.
For more information about medicines, supplements, and health equipment, don't hesitate to ask your Watson's pharmacist.
From devices that help you track your blood pressure and blood glucose levels to comprehensive supplements, vitamins, and equipment, Watson's has everything you need to support your heart health every day. Omron Blood Pressure Monitor provides accurate and comfortable upper arm blood pressure measurement with its enhanced IntelliSense technology. Puritan's Pride CoQ10 is a supplement that helps manage blood pressure and cholesterol while providing protection from cell damage. Watson's garlic capsules support the immune system by increasing the body's resistance to harmful outside elements. It's also known to help keep blood pressure in check. Watson's omega-3 capsules have omega-3 fatty acids found in fish oils that support blood pressure maintenance and overall cardiovascular wellness. Watson's lycopene capsules contain lycopene and pumpkin seed oil that are known to support heart health. CardiClear fish oil is an omega-3 supplement made from cold water fish oil with added lemon that reduces fatigue, memory issues, and circulation problems. Watson's B complex contains essential B vitamins that support neuromuscular and liver function. ATC fish oil contains omega-3 and DHA that work together to help lower cholesterol and manage inflammation. Farix B complex contains vitamin B1, B6, and B12 to help prevent neuropathic symptoms. It also boosts your energy to power your body and brain function daily. Neurobion with vitamin B1, B6, and B12 supports the nerve function and helps manage neuropathic symptoms associated with diabetes. Habit Magnesium and Calcium plus Vitamin D capsules provide cardiovascular support and aids with strengthening bones and immunity. We have comprehensive essentials for your heart care needs. Get them through the Watsons app or at 1,100 plus stores nationwide. I'm Samantha Purvor, and remember, whenever you need support for your heart, count on Watsons to help you take care of it with love.